Hi, I'm Dr. Brian Kaufman, the Chief Medical Officer, Executive Vice President, and co-founder of the nonprofit CLL Society. And I'm going to be talking to you about some of the most important papers from the American Society of Clinical Oncology's annual meeting in 2022. Today we're going to talk about fixed duration Ibrutinib and Venetoclax for frontline treatment of chronic lymphocytic leukemia, small lymphocytic lymphoma. We have the 3-year follow-up data from the fixed duration cohort of the phase 2 CAPTIVATE trial. At the American Society of Clinical Oncology's annual meeting in 2022, Dr. Bill Wierda of the MD Anderson Cancer Center presented the follow-up data of 3 years on the fixed duration use of Ibrutinib plus Venetoclax for frontline therapy in chronic lymphocytic leukemia, small lymphocytic lymphoma. CAPTIVATE is a large and important multi-center phase 2 trial of these two drugs for CLL, and the 2-year data was presented last year at ASCO 2021. So what are the updated results? There was 159 patients that were studied with a median age of 60. They included patients with significant high-risk factors, including deletion 17p or TP53 mutation in 17%. 56% had the higher risk unmutated IGHV, and complex karyotype was found in 19%. 147 or 92% and 149, 94%, completed treatment with Ibrutinib and Venetoclax respectively. With 1 additional year of follow-up, the median time in the trial was now 39 months. The overall response rate was 96% and was the same for people in the high risk and the low risk category. The number of complete responses in patients only slightly increased from 55 to 57% for all the patients going from 2 years to 3 years. However, encouraging was the fact that the patients who did achieve complete remission, 93% had durable remissions lasting more than 12 months post-treatment. Let's look at the patients with undetectable measurable or minimal residual disease, or UMRD, in the peripheral blood. Those that was found at 3 months, 66 of 85, or 78% of the evaluable patients that could be evaluated again, maintained that UMRD status at least 12 months post-treatment. At 36 months, progression-free survival was 88%. And overall survival was an impressive 98%, regardless of the presence of high-risk features. At the time of publication, all patients were off treatment. There was no new serious adverse events that were noted in the 3rd year. As of January of 2022, 12 patients had been retreated with Ibrutinib alone after their disease has progressed. The treatment duration ranged from 3 to 29 months. Of those where there's data available, 7 of 9 of them had a partial response and 2 had stable disease, suggesting that the Ibrutinib was effective. So what are our conclusions? This is more good news for our community. Fixed duration Ibrutinib and Venetoclax provides deep, durable responses and significant time without progression off medication, and for all, including those with high-risk markers. Ibrutinib and Venetoclax ticks all the boxes as a chemo-free, all-oral, once-a-day, fixed duration, frontline therapy for almost anyone with CLL or SLL. The extra 12 months of follow-up provided no new surprises. In the 3rd year, there was no new deaths or serious side effects. Though the numbers were small, it was also encouraging to see that retreatment with Ibrutinib was largely effective in those whose disease had progressed. Odds are excellent that Ibrutinib, sometimes shortened to I plus V, will soon be a welcome approved frontline therapy in CLL/SLL in both Europe and the USA, based on the results of this trial and the GLOW trial, which we talk about elsewhere on the website, where I plus V was compared with chlorambucil and obinutuzumab. That said, we still need to study whether taking two drugs together is the best approach, or does sequencing the therapies provide better overall survival? These analyses are happening, but they will be slow to read out. And let's not forget that these are two very expensive medications that must be affordable for all who might benefit from them. On the website, we have a link to the actual ASH abstract. Thank you for listening. Stay strong. We are all in this together.